To all my brother and sister fire chiefs, chief officers, company officers, and firefighters, this is a call to arms. As president of the International Association of Fire Chiefs, I am asking you to contact the president and your elected officials in Congress. Please ask them to fund the AFG and SAFER grant programs at $5 billion each in the next stimulus bill. This is not a want, but a need. I continue to hear from fire chiefs, chief officers, and firefighters of the current or to come economic impact of the COVID-19 pandemic to their departments. Many budgets have been decimated with supply purchases and overtime. I've talked to fire chiefs all over the country who have been told to prepare for 5, 10, 15, and even 20% reductions of their frontline firefighters. Volunteer fire departments have been unable to fundraise. The AFG will benefit volunteer combination and career departments by paying for supplies used or to pay for restocking critical medical equipment, supplies, and equipment. SAFER will help volunteer and combination departments through recruitment and retention programs. SAFER funding will also retain current career firefighter positions. I urge you to contact Congress and the White House. It is simple to do so. To contact the White House and Congress, use the link in the email that was sent to you, or use the URL shown below or in the video description. Thank you, and may God bless the United States of America.
Welcome, everyone, to the 8th webinar held by the IAFC on our coronavirus impact. My name is Gary Ludwig. I'm honored to serve as president and the chair of the International Association of Fire Chiefs. What you just saw and heard was my latest call to action or call to arms for everyone, I'm talking about everyone, not only chiefs, but also company officers, firefighters, your relatives, your friends, your neighbors. Everyone needs to send a message to Congress about the needs for the fire service going forward. We need $5 billion in the AFG grant program and $5 billion in the SAFER grant program. These are not wants, but needs. And so I encourage you to reach out to our elected officials in Congress and the White House and let your voice be heard. You can do that at iafc.org/take-action. Merely just click on that. There's a box there that says support COVID-19 funding for fire and EMS. Just click on that, and most of the letter is filled out for you. You just got to put in some additional information, your zip code, your email address, and your address, and it'll determine who are your elected officials and send it off. Please encourage you to do that. As I said, this is our 8th IAFC Coronavirus Task Force webinar. We conduct them every Monday at 4 p.m. Eastern Standard Time. I want to thank everyone who's joining us in this webinar today directly or later when you listen to it in a recording. The IFC represents over 1.2 million firefighters and over 30,000 fire departments in the United States. We also have members in Canada and other countries around the world. Our Coronavirus Task Force is chaired by Chief John Sinclair, and our Economic Task Force is chaired by Chief Steve Pegram. You'll hear from both today. You'll also hear from our own Dr. Jim Augustine, who will give us the latest information, medical information as it pertains to the coronavirus. His information is almost timely, is always timely, I should say, because this information just changes, again, not only daily, but almost hourly. You also will hear from our Government Relations Director, Ken LaSala, who will provide a legislative update. And lastly, as we start seeing more of the mental and psychological impact of this coronavirus on our firefighters, I continue to see firefighters who are committing suicide. We saw recently in the news where one of the doctors in New York City who was treating a lot of the coronavirus patients also committed suicide. The impact to us mentally, psychologically is there. And so joining us today will also be Chief Dan DeGryse, who's retired chief from the Chicago Fire Department, and he's currently the director of the Rosecrance Florian program. So with that said, I unfortunately have some grim numbers to report today. Before I turn it over to our first speaker, we had a phone conversation with Ron Sarnicki, who is the director of the National Fallen Firefighters Foundation today. And I was looking for someone, and the NFFF is someone who is tracking all the deaths from the coronavirus. I thought we were somewhere in the teens. I have a grim number to report today. That number is 41. They have documented 41 firefighters and our EMS personnel who deaths are attributed directly to the coronavirus. That is that 41 breaks down to 22 firefighters and 19 EMS personnel. And I'm afraid that we're going to see more as we go forward with this. So again, thanks to Ron Sarnicki and all those over at the NFFF who are tracking this important information. With that said, we're going to start our webinar today, and I'm going to turn it over to our Coronavirus Task Force Chair, which is Chief John Sinclair. So John, you now have the floor.
Thank you, President Ludwig, and thank you for everything that you are doing. I know that you're working 100 hours a week as we look at this. I've been on a number of phone calls with you, and you are showing true leadership. So thank you for that. One of the things, and I don't want to bury the lead here, is that Chief Ludwig, Chief Pegram, Ken LaSala, our Government Relations Director from the IAFC, and myself have had the opportunity to be on a number of calls with a number of committees of jurisdiction within Congress. We have had the opportunity to have conversations directly into the West Wing. And I know last week we had a conversation with Senator Schumer's office. This morning we had a conversation with Speaker Pelosi's office relative to President Ludwig's call to arms of the $5 billion for SAFER and also $5 billion for AFG. Those conversations have been startling for some members that have not just the sticker shock, but the impact to local government and how that impacts federal response. One of my goals has been to explain to them what it's going to do relative to fire season, and something as simple as the USAR task force readiness, because currently, as of this morning, of our 28 urban search and rescue task forces, we only have 15 that are available. The others are mission ineffective because of a lack of local government augmentation of those teams. So it's very important that we understand that federal assets are only federal assets when they are staffed up by local assets. And it is also important for us to know what's going to happen relative to fire season. That there is a number of teams, incident management teams, that are staffed up with local fire departments. So as we look at states beginning to open up, we'll see what happens, but we're likely going to be in this sort of modified response from the fire service for months, if not years to come. And so I urge everybody on this, when you look at this, to be looking at it, this is not a sprint, this is a marathon. And until there's a viable vaccine that Dr. Augustine can talk about, which is months to come, we're going to be in this. In those states that are continuing to be locked down, one of the things that the fire departments need to be looking at is to be looking at your civil unrest protocols and policies and the relationship you have with local law enforcement, because there's a couple of things that are predictable, is that if people remain locked down, we're probably going to see some civil unrest. And the other thing that we'll be looking at is the likelihood that we will see an increase in arson fires as this impacts the economy. So those are all things that we need to be thinking about as chiefs and seeing how that's going to impact that. And with that, I will turn it back over to President Ludwig. Thank you for the opportunity.
Thank you, John, and thank you for all the yeoman work that you are doing. It's outstanding. You took on the coronavirus task force chair. In the past, I asked you to take that back in February. You didn't hesitate. You graciously accepted, and you have done yeoman work there. Outstanding work, phenomenal work. I wish I had more words to describe what you and those task force members have done, including our next guest that I'm going to bring up, who's also a member of that coronavirus task force, which is Dr. Jim Augustine. And so Jim, again, is always a good friend for many years, and he always provides timely and accurate and updated information on what we can expect out there. So Jim, you now have the floor, and again, as we typically are, we're students of yours listening to all the information you have.
Chief Ludwig and Chief Sinclair, thanks to both of you for your leadership in regard to this and your ongoing contributions across the country, not only to the day-to-day issues of firefighting, but this crisis with the pandemic. If I could have my first slide. I'm going to introduce this a little different this week. We need to talk in our communities not about the number of cases of coronavirus, but the impact. And the impact right now that we're most concerned about is hospitalizations and deaths. What every fire chief needs to understand is probably very much what they understand at the local level. That during the winter months is very frankly in the United States the dying season. And if you look at the two graphs that are part of my slide here, one looks at the CDC reported deaths by month of the year. And you notice that we have a significant peak in the months of December, January, February, and then the number of deaths per month slides down and gets to a minimum in the months of July and August. The nature of deaths changes. That's not part of this slide, but you would understand infectious diseases have relatively little presence in the middle of the summer in most of the United States, but trauma and injury take a bigger proportion of the deaths. If we look at the deaths that have been reported in the United States from December until the first half of April, you will notice that we've had a decrease in deaths. And that is as this country went into lockdown and as all infectious diseases began to decrease, as well as very significant decreases in the amount of trauma and injuries from people being in their homes, we've had a slip of the number of deaths down below the usual figures of around 7,500 deaths a day. But in the last 3 weeks, that number has begun to increase, and it very much is related to the coronavirus deaths. I want you to focus on this and think of this as you do your local planning, and as we talk at the end of my presentation about planning for potential additional waves of coronavirus. And locally, much of the planning has moved away from the total number of coronavirus cases to those which cause hospitalizations and deaths. Next slide, please. As always, I talk about what's important. We want to know when our staff members are sick, and that's very important that we know how to do that. We do that at the beginning of a shift or as they arrive for calls on volunteer and other types of agencies. And so we do a symptom check. And we use a thermometer in certain cases to see if someone potentially has a viral illness, in particular one that oftentimes presents with a fever, and that's coronavirus. When we talk about our patients being sick and we receive 911 calls for service, it is the pulse oximeter that gives us very valuable information to tell us how sick the patient is. So a reminder, 2 important devices for use in your department, the thermometer for your own staff, the pulse oximeter for the patients that we treat. Next slide, please. The range of symptoms of patients with coronavirus is quite wide. The CDC updated its guidance 2 weeks ago. Yesterday, in my shift in the emergency department, I saw cases of coronavirus that had very wide differences in how they were presenting. Some of that is based on age. We know that deaths are disproportionately related to senior age in the coronavirus outbreak, and in particular, people over the age of 60, and then very much in patients over the age of 80 who have coronavirus have very high incidence of death as an outcome. There are growing numbers of patients who are asymptomatic or minimally symptomatic who are found to have the coronavirus. That has been an issue with spread of the disease and has forced us, again, to think through how this disease has spread so far and how it may spread in future outbreaks. Next slide, please. As we work through our personnel safety in the fire department, in our EMS quarters, et cetera, very nice to have a form that we began to use at the beginning of the coronavirus outbreak. It lists the most common symptoms of coronavirus and the ones that really should alert us that potentially this patient has it, this person has it, then the person is one of our staff members. And that is designed for a 14-day look at personal health and potentially a documentation site for 2 temperatures per shift for a 24-hour shift. Next slide. My usual briefer on testing. 2 types of tests. One looking for the virus, that's called PCR testing. It involves swabbing the nose or throat or spitting into a bottle. Many of those types of tests are coming up that have rapid answers. The quickest of tests can give you an answer, yes or no, is the virus present, in 15 minutes. That is excellent for decision making for our staff members who are ill, for their family members who are ill, for other key members like nursing home staff members, whether they have the virus or not, and immediately they can go into quarantine or isolation. Next slide, please. A growing amount of discussion now in the lay media is about testing for antibodies. I have urged you all again to be very, very suspect of any scientific claims about antibodies and their use in making decisions about persons working or not working. As yet, we do not know the relationship of the antibodies to long-term immunity or their ability to predict who is sick and can go back to work or not go back to work. Nonetheless, an explanation of the antibodies are proteins that are a very important part of the immune response to infectious agents. The infectious agent we're worried about now is the coronavirus. The first antibodies that are built are IgM antibodies. Later on, we produce IgG antibodies, and those are our long-term protection against infectious agents. We use those antibodies every day in our everyday fire EMS protection against hepatitis, rubella, roseola, and other diseases that we either had as a child or are protected because we've had vaccines for the younger members of our crew. Next slide. Testing is in these new cards or small discs that are used. As yet, every organization around the globe has said durable immunity is not a guarantee in this disease. We do not know if the presence of IgG is a real testament to the fact that an individual has long-term protection against the novel coronavirus. We will take some years to really figure that out, as this new virus has some new characteristics which we don't understand. It will be important in the short term that we figure out what % of our population has been exposed, and that is the job of durable, reliable antibody testing. That will be part of research protocols, some of which have been carried out already in our early impact cities, Seattle, California, New York City. Next slide, please. Testing is an important part of future waves. Allow us in the fall and winter months to understand what individuals to be contained in terms of the virus. And the presence of rapid testing in large volumes will assist us in our staffing decisions within public safety services, within nursing homes and other congregate care facilities, in jails, and in other places. That will again be swabs or saliva testing. Next slide, please. What is becoming increasingly important is how we plan for the next months and for the next years. A growing number of our policy making and infectious disease experts are concerned that there can be additional waves of this virus. Many of the viruses that have caused pandemics in the past have had a second wave of spread that was worse than the first. That is demonstrated on this slide as the second case scenario. The Center for Infectious Disease Research and Policy, based in Minnesota, has been spot on so far in terms of predicting the impact of outbreaks in this country and in countries around the world. What they currently have posed for us are three scenarios. Scenario one is where there's peaks and valleys of occurrence over the next few years, some of it based on population behavior, like distancing and staying out of congregate outbreaks. But until we have a vaccine, we will continue to see peaks and valleys. Scenario two is where we have a relatively large outbreak this fall and winter, and is frankly what we as fire EMS leaders need to be prepared for. A third version of this is what happened to both SARS and MERS, and that was the slow burnout. And the slow burn scenario has the virus being less virulent, less able to find victims, in particular because of social distancing and other behaviors that are good on our part. But eventually we have so many people who've been exposed to the virus that it doesn't find ready hosts and cannot spread as easily. That is what we were hoping for, what we are hoping for. Nonetheless, we have to plan for the other scenarios. Next slide. So the key to my presentation this week is very honestly what the CIDRAP, the center, recommends in terms of behavior on our part and messaging to our communities. We should be prepared for the worst case scenario. As Chief Ludwig led us off today, saying that we need funding for training, for PPE, for testing, and for our day-to-day operations as we move into the fall. It will be very important that we continue to communicate that to federal and state leaders as our local governments are stretched very far because of the financial impact of the pandemic. Number two, we should be building concrete plans for disease resurgence, including the impact on our communities and the impact on our workforce. Number three, we need to be active in preparing the public for behaviors that we need to change again as we arrive in the fall and winter months. And in particular, if it's a bad outbreak and we need to go back into the social distancing, close down business modes again. If we don't have successful vaccine production, then this may be a recurrent plan over the next couple of years. As you have recognized so far, the public tires very quickly of the messaging. We need to be consistent. We need to be as accurate as we possibly can be, and we need to be honest. Next slide. So our current challenge is in return to business and reopening of many services in our community that we need, preparation for a potential next wave of patients, and then building the elements of testing, identification of sick persons or asymptomatic carriers, and containment of that is part of what we do every day. You know, now when we have outbreaks of gonorrhea, syphilis, herpes, meningitis, and other bugs, that public health agents go to the patient, they find out who they have exposed, they treat, isolate, quarantine those individuals, and we knock down other outbreaks on an everyday basis based on long time established formulas. That will be the approach as we move into the fall. And then hopefully we don't see a resurgence, but if we do, we will need to have millions of tests available identifying people who have the virus, whether they're symptomatic or not, and then containing the impact of those individuals. Next and last slide. This summer, we will be watching the Southern Hemisphere, so that in particular is Africa and South America, to see if there is spread across those continents. In our coming winter, it will be very important, and you might as well start messaging now that both our members and our communities will need influenza vaccinations at a higher rate than we have in the past, and be prepared to separate coronavirus from influenza and other routine winter illnesses, RSV in the kids, and other things that will be very important for us to be prepared for next winter. The PPE situation needs to be addressed on this continent, and probably all of you recognize that supply chains that have been stressed internationally lead us to needs for manufacturing and distribution on the continent, and then ongoing work and support for vaccine research and implementation, and the potential that Fire EMS will be involved in distribution of vaccines. So as we did in particular with H1N1, where Fire EMS agencies were active, and then some of you around the country were active also in hepatitis A vaccination programs. Our states need to be ready to support the Fire EMS workforce giving vaccinations, going to public people in need that aren't as mobile as others, being able to identify places where the vaccine would be needed the most, and be able to put those programs in place. Chief Sinclair, Chief Ludwig, thank you for the opportunity to present today. I get a lot of questions following this. I always welcome them across the Chief's leadership, and I thank you all for what you do every day and as we move into the summer. Chief, I'll turn it back over to you.
Thank you, Jim. Again, outstanding information, timely information, and very relevant information. I'm so appreciative for you always providing us with this information and also serving on a coronavirus task force. I had to perk my ears up a little bit when I heard you talk about the second wave. One of the books I read several years ago and had to go back and reread it again is a book by John Barry called The Great Influenza, and it talks about the Spanish flu from 1918. How the second wave was actually much more deadlier than the first wave because the virus mutated, and it was actually a more potent strain is what it was. And so I pray that that doesn't happen this time. Let's just pray it doesn't happen. So, but thank you again, Jim. Appreciate it. With that said, I'm now going to turn it over to our Director of Government Affairs, and that is Ken LaSala, who is another one of our IAFC rock stars on the staff there that does outstanding work. And so, Ken, you now have the floor.
Thanks, Chief Ludwig. I just have two slides to go through today. The first one is dealing with legislation. As has been said, we're working very hard to get $5 billion each for the Assistance to Firefighters Grant Program and the SAFER Grant Program. You know, the one thing I just wanted to highlight, I think Chief Ludwig and Dr. Augustine raised some important issues to take a look at and why we need to make sure the fire departments are funded both through the summer and the fall and into next year. But in terms of the actual Action Center, we tried to make this process as easy as possible. So basically, all you need to do is go to that link, click on the part that talks about COVID-19 aid for fire departments, input your address, and then, you know, just send the message, and it goes directly to your member of Congress, both your representative and both of your senators. So we try to make this as, we know how busy you are, so we're trying to make this as easy as possible for you, and we really appreciate, so far we had a couple hundred people, you know, submit their comments through our system, and we really appreciate everyone taking their time to do this. Moving on, there's some new legislation being introduced on the Hill to deal with Public Safety Officers Benefits Program. Currently, the Department of Justice has said that the families of fallen fire and EMS, or firefighters and EMS personnel, and of course law enforcement, who become disabled by COVID-19 They are eligible for PSOB benefits if it's more than likely that the firefighter or EMS personnel were exposed on the job and then came down from COVID-19 from their work on the job. There's obviously some wiggle room with that whole more than likely thing. So basically, Congress is moving to introduce legislation to clarify things. There's one bill already been introduced by Chairman Gerald Nadler of the House Judiciary Committee. That's H.R. 6509. And we also expect some legislation to be introduced early this week by Senator Chuck Grassley from Iowa. And basically, both bills make it clear that if a firefighter, EMS, or law enforcement personnel were exposed on the job to COVID-19, and unfortunately they pass away, become disabled, their families would become eligible for PSOB. These are not straight out presumptions. Both of them have a time period, roughly from around January 2020, and then the Senate bill would go to December 31st, 2021. The House bill would go for a year after the public emergency runs out. And then also, in both cases, there's a connection. The firefighter basically has to start coming down with symptoms and start to unfortunately pass away from COVID-19 within 45 days of their last time on duty. There are some conditions to these bills, but needless to say, they do help to clarify things. And we expect to see congressional action fairly soon on both bills. Moving on to my next slide, just want to talk for a couple of seconds about grants. As you all can see, the COVID-19 AFG grant application period is currently open. And then also there's a SAFER grant application, a fire prevention and safety grant application are now open. I also want to talk to you for a couple of minutes about HHS payments. There's a really good blog that the IAFC EMS section and Evan Davis on my staff put together. I really recommend that you spend some time reading it. It's not very long, but it's pretty detailed. Basically, there's three ways that the U.S. Department of Health and Human Services are funding fire departments for COVID-19 response. First, 6.19% of the total Medicare fee-for-service payments from last year, so it's only roughly about 6% of that total, has been sent to basically the CMS ambulance suppliers and providers. Now that funding was sent to the tax ID number. So many fire departments across the country have received this funding. If you haven't, please check with your city management and see if something just showed up in the city accounts or the county management. In order to clarify things in the future, CMS has now rolled out a web portal for more payments along this line. So your department would have to go into the web portal and then register, and then it will go through the process of how you get paid or reimbursed for your COVID-19 expenses. And then for fire departments that end up transporting uninsured COVID-19 patients, HRSA, the HHS Health Resources and Services Administration, has now rolled out its own website and its own portal where you would go in and register for reimbursement through ground transportation. For all these, I know there are some questions about balance billing. Basically, it says that you would have to bill the patient as if you were in network. So that could create some issues for some fire departments. And that's just something to take a look at. And then, as fire chief, you'll have to make decisions about whether or not you want to take the HHS money or not. And we'll have some further discussions in future webinars about some of the issues regarding HHS payments and reimbursement for some of these expenses. But nevertheless, I wanted to raise this to your attention. And like I said, for the links to the portals and everything like that, and a bigger discussion about the balance billing issue, I recommend that you go through and take a look at that blog that I've got linked there on the slide. And that's pretty much my report. So I'll be glad to turn it back to you, Chief Ludwig.
All right. Thank you, Ken. Thank you again. Again, very timely information. We appreciate all the work that you and your staff are doing up on Capitol Hill, advocating for the IFC and its members and the fire service as a whole. Again, you're making a tremendous impact, and we appreciate it. I appreciate it. I'm now going to turn it over to our chair of our economic task force, which is Chief Steve Pegram. And again, Chief Pegram is putting in, just like John Sinclair and a lot of others, is putting in just an untold amount of hours working on your behalf. So Steve, you now have the floor. You can update those listening about the economic issues.
Chief, can you hear me okay?
I can hear you fine.
Okay, great. I know we had some trouble last week, so thanks for bearing with me. We could go to the next slide, please. So the Economic Task Force has been looking at the impact of COVID-19 both on our operating budgets, but also on the revenue that funds our fire and EMS community. As I think everyone knows, costs have gone up. A lot of these costs were not anticipated as part of our 2020 budget and are in response to COVID-19, whether that be acquiring personal protective equipment, deconning vehicles and stations, overtime, backfill, coverage issues, and all while the costs are going up, we're seeing a downturn in revenue. It appears from the data that we've seen and we've been tracking, the communities that rely on sales tax and income tax or earnings tax felt the hit almost immediately, as those revenues were cut as soon as businesses closed and the stay-home orders spread across the nation. And but we're also tracking how that's going to impact property taxes and other forms of revenue. As Ken talked about, it's having an impact on EMS billing and that as well. And then also, you know, talking about our volunteer communities, many of our volunteer fire and EMS agencies have very little tax support or none whatsoever. And so they're relying on fundraisers. And when the stay-home orders were given and businesses closed, makes it extremely difficult when those organizations can't do their normal fundraising activities. They're not running their bingo hall or maybe doing a pancake breakfast or another event that they typically do, especially as we get into the spring and summer months. So it's really having a negative impact across the board from a revenue standpoint. And that's part of the call to arms that Chief Ludwig spoke about, and I encourage everybody to look into. As has already been stated today, Chief Ludwig, myself, have been on multiple conference calls with the White House, with FEMA, with DHS, with the Senate, with Congress. Talk to them how important it is for the to COVID-19 and to be hit with cuts to our budgets, and cuts will come as layoffs and furloughs. So that they look at funding the AFG and SAFER programs, not the current grants that are going on. SAFER is open right now, but that is to add additional firefighters under the normal rules. What we're asking for is a separate SAFER grant to retain firefighters, basically prevent layoffs or bring back any firefighters and paramedics that are laid off, to the tune of $5 billion for equipment, supplies, and to make up that loss of revenue that we're going to see and help balance our budgets in 2020 and 2021. So part of that, and when we talk to people in Washington, D.C., you know, they want numbers, they want statistics, they want stories. So the IAFC did launch a economic impact dashboard and survey. Hopefully many of you have already taken that survey. If you haven't, I please encourage you to do so, because it is that data that we're using to spread this message in Washington of the need of our fire and EMS community. Currently, we have about 2.5% of the fire departments across the country that have reported into that economic impact survey. If we can go to the next slide, please. This is what the dashboard on the IAFC website looks like. And this photo was taken earlier today. But you can see in the top left-hand corner, about 720 departments thus far have filled out the survey, and their data populates into this. And you can do a lot of different searches by region, by map, by state, by type of agency. But if you look again in the top right-hand corner, you'll see already with only about 2.5 to 3% of the fire departments in our country reporting at this point, we're already looking at a loss of over 1.2 billion with a B in revenue. And then projecting in 2021, that is over 1.4 billion. So if you multiply that out, it's very easy to see that the economic impact to fire and EMS budgets across our country easily could be in excess of $50 billion. So that's why we feel it's so important and why we've spent so much time talking to those in Washington, D.C., and we encourage you to reach out to your local, state, and federal resources and representatives and make sure that they understand this immediate need. This is not a need that's going to, these are not wants, as we say. There's no 912 when people call 911. We have to respond, and we're very concerned as we get into fire season and the wildland issues, when we talk about the USAR teams, as well as the continued response to the pandemic. What are we going to do when fire and EMS communities are shutting down fire stations, closing companies, reducing manpower, all while responding to the normal day-to-day stuff that we do every year and this pandemic? So very important that we get information from you into that survey, and we can share that information with our federal representatives and try to get the funding that Chief Ludwig has requested in that call to arms. So that's pretty much the snapshot of our committee. I want to thank Chief Ludwig, Chief Sinclair, everybody else on this call, as well as my committee for all the hard work that they've done thus far. And if anyone has any ideas or needs more information, please reach out to us and we'll try to get those addressed moving forward. Thank you, sir.
All right. Well, thank you, Steve. And again, great work being done by your committee, phenomenal. And just, again, so important and so imperative at a time like this when I continue to hear from fire chiefs out there that their city managers and mayors have come to them and said, you need to start preparing me a budget that looks 5, 10, 15, and even 20% in a reduction of your workforce on the front lines. And chiefs are just shaking their heads. I know of one friend outside of Chicago who is a chief, and he's already been furloughed 1 day a week. And I thought, oh, 1 day a week. And it took me about 10 seconds to do the math, and I realized that's a 20% pay cut just on him. So anyway, again, great work, Steve, and appreciate what you and all the members of the task force are doing. So I'm now going to turn it over to our guest speaker, who comes to us as retired chief from the Chicago Fire Department, and he's also the director of the Florian Rosecrance program that deals with mental health and resiliency and many of the other issues that we know are beginning to impact our workforce out there. There's no way that you continue to go on these calls and expose yourself as you do and worry about bringing it home, and there's got to be a mental impact of that. And so we're going to start on these webinars, start talking about that and how you that are listening can start, again, looking at programs within your department, how you can get help to your people. And so with that, I'm going to turn it over to our guest speaker today, which is Chief Dan DeGryse. And so, Dan, you now have the floor.
Hey, Chief Ludwig and everybody that's listening. Chief, first, thanks for having me on here, and also to the IAFC COVID task force that you're actually including mental health and behavioral health. So needed. I've been in this field for really, well, in the fire service 30 years, and just as a lowly battalion chief, not as a fire chief. I didn't want that added responsibility, and I enjoyed being a battalion chief. But I also been in the behavioral health field since 1986. So I've been around for quite a while. What I first want to say, talking to many of the men and women across the country, is kudos to you and a damn good job by all. This is another crisis. There have been crises since the dawn of the day, and there'll be more. And it's remarkable, honestly, truly remarkable on how we respond. I'm going to take you through some slides here that we are going to cover some things that you probably know, and I'm going to add some stuff to it. Let's just talk about response to crisis. There's an automatic and a learned response. We all hear the fight, flight, and freeze response. That's automatic. We cannot stop that. We can adjust it, or we could manage it over time if we know a little bit about it, and we'll talk about that in a little bit. But I want people to understand that things happen and our body automatically responds. Most of us, if not all of us in the fire service and as a first responder, and many of us have second jobs that are maybe nurses or doctors or EMTs, work for another department. You fight. You're not freezing, you're not running away, you're not hiding, you are fighting. Well, just so you know, over a period of time, that has an effect on our body. From a learned response, what happens is that, let's just think about Pavlov's theory in regards to the dog and food, right? And as food is introduced, there is response, it salivates. Now, Pavlov, what he did is he introduced a neutral stimulus, and that was a bell. So when what would happen is before the food would be introduced, he'd ring a bell. And then what would happen is the dog would link together food and the bell and then start to salivate. And as time went on, he realized that the dog connected the fact that he opened the door. And so when he opened up the door, the dog would start to salivate, and then he connected the footsteps. So it's a learned process. And what I want everybody to think about is, think about your five senses. Think about sight, sound, smell, touch, taste, how we take in information. Many times I talk to fire chiefs and volunteer fire service individuals or people that just can't get away from their phones. And when that phone alarms, when you get a notification, whether it be an email, a text, a phone call, or a message, that triggers your something inside of you. And so keep that in mind as we go a little bit further. So there's automatic and learned responses. Next slide, please. So physiology, and many of you know this. So you have the amygdala. The amygdala is something that is an organ in your brain that manages mood, motivation, and fear. And you have the HPA axis, hypothalamus, pituitary, and adrenal gland. Basically, what I'm telling you here is something you already know because you've probably studied this, is that this gets you your adrenaline and another thing called cortisol. And that gets your system heightened and ready to typically fight in our career. What I want you to keep in mind, just like the senses and the learned responses, is the duration and number of times your body or that system is triggered. And we have, as we know, acute and chronic. Acute is right now, and chronic is over a period of time. Well, think about your first couple weeks on the job, and then think of 15 years down the road. And for many of us, well, for many of you that are fire chiefs that have been in your career for 30, 35, 40 or more, how many times has your body been triggered that you really don't realize it's happened? How many times have you, and just think about this, is that you might have been like me sometimes where you woke up in the middle of the night and didn't know it. And your spouse or somebody else tells you, yeah, I remember one time in the middle of getting woken up for a watch, and I remember I didn't remember, but the gentleman knew that I had a conversation with him and sat up and then laid back down, but I was completely exhausted. So keep in mind that our body responds, but how much can it take? Next slide, please. Oh, there we go. So these are things that we typically know, but I want you as an individual, you as a officer, you as a friend, a coworker, and as a fire chief to keep this in mind. These are not things that are very difficult to understand. These are things that are happening day in and day out. But signs and symptoms, physical or physiology response in regards to your heart rate, when somebody gets anxious or when he gets startled, that uncomfortable or uneasy feeling And what does that feel like? And here's the thing is that who do you tell about that uncomfortable or uneasy feeling? Usually nobody. Headaches. We usually attribute that to food or lack of sleep. But as your system is continuing to be triggered and overworked, your brain, your neural pathways don't necessarily work the way they would if you were completely at rest or rested. And so then you get frustrated and you get headaches. Not that doesn't come in there, but you get headaches and uncomfortability, and then sets in fatigue. And then you go to psychological responses. We know some of those people that have always been angry and irritable. What I want you to look for in yourself and other people is, how is your response? How is the response of other people? Has it changed? I won't necessarily get into suicide, but there are some people that are have thoughts of suicide their entire life. I had a father that was suicidal for a good part of his adult life, for 35 years, and 3 times he was actively suicidal. But just because he had thoughts of suicide didn't necessarily mean that he was going to act upon it. What I want you to keep in mind is, as the stress builds, as your system is triggered, as your senses take in all the the TV input, the runs at the firehouse, the phone calls, the stressors, the finances. Just when Steve was talking about being a shortfall of $1.2 billion, I can't even conceive that. How is that changing somebody's personality, and how are you responding to that? The fear. Come on, is there anybody that you feel comfortable with throughout your career that you've been able to say, hey, yeah, I'm scared to death? How many times have you said that? You probably said it to yourself, but you're afraid to say it to somebody. It's okay to be afraid. I wish somebody would have said that my first day in the academy back in 1989, because I didn't share that with anybody. But if as we have that fear, the thing is what do we do with it? And then the reality is that we typically, as we'll get to in a second, will isolate. Hopelessness and guilt. Those are 2 very serious psychological responses. If you do not have hope in what you're doing, if you don't have hope that this pandemic will get rectified, if we don't have a plan in place and hope that we'll have a job, we'll have PPE, that people like the IAFC COVID task force is doing what they're supposed to, there'll be a disconnection and a sense of hopelessness and a lethargy that will not be beneficial to not only the individual, but the individual's family and then the department. And then guilt. Here's the thing, is that the fear, the irritability, the hopelessness, there's something that really doesn't ever go away, is feeling guilty as a result of not being able to do something about something. We are trained to mitigate anything that's in front of us. Right now, the best minds are being put to the test to manage something that we haven't really seen for basically 100 years. We don't know what the future holds. What we need to do is make sure that we each do our piece and don't try to do more, so you don't feel like don't feel guilty like you can't handle it. Manage your own space. Next slide, please. So the behavioral response, and this is something that we know, but we don't probably, and I'll speak for myself, don't always probably acknowledge as much as we should, or I should. Conflict with ourselves, the cognitive dissonance in our mind of what we should or shouldn't do. Should I go to work? Should I talk to my spouse? Should I take a nap? Should I go get something to drink? Should I eat something? Should I take a break? Or do I need to keep on pushing on? How do we know what that conflict is going on? And I'll talk about in a slide or two, really how leaders from the department, from the fire chief down, need to understand that conflict is going on within people's bodies right now because they don't know. They don't know what's happening tomorrow. They know they have to go to work, and they know they're going to be quarantined and having to manage certain restrictions based on their department, based on their municipality, based on their state, based on their government. And that's a little bit frustrating. That creates conflict in somebody's mind. You have to ask people, hey, what's going on in your head? Eating and sleeping. Okay, eating, you could see somebody if they're not eating at the table. Or how about you, your intake? Sleeping. I know for myself that I have 4 kids, I have a job, I have responsibilities, I have just bought a house, didn't sell my other house. Some of that pressure is affecting my ability to stay asleep. What do we do about that? How do you address that? If you are waking up in the middle of the night, if you are not able to get to sleep, if you're not sleeping long enough, those are behavioral responses to the stress that we are being exposed to. And then I mentioned a little bit earlier about withdrawal and isolation. That is a key thing that you have to identify for yourself, your family members, especially your spouse at home, like mine. A lot of times she'll be watching that TV. I'll come home and she'll be like, do you know what's going on? I go, and I'd be like, yeah, I do. But how many hours did you spend in front of that TV? Turn that thing off. But I guess what I'm saying in regards to that isolation is we're inundated by the information and you don't feel like you can make a difference. People then have all these responses and then may lead to social isolation, mental isolation, withdrawal from other people at the firehouse, and you have to be aware of that and ask people, hey, are they doing it to take care of themselves as a self-care, or do they not know that they're doing that, and or are they doing it because they just don't know what to do? Next slide, please. So this is something that many of us I'll kind of joke with Chief Eversole, unfortunately, who was passed. He worked for the Chicago Fire Department, and I remember taking many classes with him. And how many times in hazmat did we hear time, distance, and shielding? So in regards to recovering from stress and recovering from our day's work or 24-hour shifts or 48-hour shifts, and all of you that are working overtime and the pressures that are on there, you have to keep 3 things in mind right off the bat: time, distance, and shielding. Take the time to take care of yourself. And when we talk about distancing, it's kind of the same thing, but I just use this as kind of not an acronym, but something that we can understand is that as our mind continues to get focused on the stressors that are out there, from finances to our kids in school to work to trying to get some sleep to what does our side job look like to what does our spouse's job look like, what are the men and women that work for us, how are we going to manage them? The $1.2 billion is going to be a shortfall. Is you have to distance your mind from, for lack of better words, the craziness. And then the shielding is to really kind of protect, like, the simple thing is, if it's cold out, you got to cover yourself, right, with clothes. If you're out in the sun, you got to cover yourself with a hat and sunscreen. With all the stuff that we see on TV, all the runs that we go on, all the sight, sound, smell, touch, taste, is you have to shield yourself from that, and you have to do a bit of self-care. And whether that means 5 minutes, 25 minutes, or an hour, it has to be done. If you look at the bottom, and I'll talk about self-care in a second here, just like hydration, if you wait until you need it, it may be too late. So time, distance, and shielding. And self-care, I don't need to tell you, hey, go ride a bike, take a walk, read a book, watch a movie, do a crossword puzzle, do a family night, go cooking a barbecue. Hey, you know that. The four things I want to kind of address here. You need to rest. Your body and your brain needs to rest when you're inundated all day, every day, not only from COVID-19, not only from finances, not only from the pressures of being, a part of the family in a fire service, also being maybe the head of the household or a spouse, relationships, those headaches, eating, you need rest so your body can recover. One of the key things in anything, you need that connection. Greatest job that I ever had in my entire life is the fire service. Loved going to the firehouse. We always kid as retirees, we don't miss the circus, we miss the clowns. You have to stay connected. One of the biggest things, if you learn about suicide, is once people break connection with others, that'll lead down a negative path. So stay connected, force yourself. And if you see people that are isolating more at the firehouse or not, well, no one's going to events right now, but if you have Zoom events or if you have phone calls and people aren't responding, check in with them. Family, take that time. I'm a perfect example of that. I always have one more thing to do. There's always 2 or 3 more things to do. My list has never been done. Your list has never been done. There's always somebody you need to call, something you need to do, a budget you need to check. Find that time in your day to have some time with your family or your spouse, or to give your son or daughter a call wherever they're at. And that release, that's up to you. Whatever works for you, let that out. If it's working out, if it's screaming, if it's running, if it's doing push-ups, and there's more, obviously. You have to take the time to do that self-care. Let's be honest, is that rehab in the fire service, we fought it for many years, but it's necessary. We know that. So self-care here in regards to crisis, it's necessary. Next slide, please. So here's where everybody comes in. This isn't just for the chiefs, the officers, or the senior firefighter. It's all 3 of them, and all the way up and down the line is we need to work together. We need to stay connected. We need to have those conversations. I can remember back like it was yesterday, and many of you can, where you were sitting or where you were standing or where you were working when 9/11 hit. You probably knew many people in the fire service in New York, and you probably lost some people too. Time will heal, but what did you do then? What do you need to do now? We need to stay together. We need to take care of each other. We need to have communication. If we learn anything from OSHA and NIOSH, in regards to, well, NIOSH specifically in regards to line of duty deaths, communication is key. If we don't want to lose members, if we don't want to lose our family, whether it be at work or at home, we need to stay connected. And that comes from modeling it, from leadership. And again, all you fire chiefs, you have a huge responsibility. All you officers, and then senior firefighters, have you all come together to have that conversation and just say, hey, how are you doing today? This could happen, and this could happen in many different ways. What I want to say is easy on the emails. I think we all know that. Be willing to offer your time and just say, hey, you know what? If you want to talk, give me a call or come into my office. One of the things that I love the most as a battalion chief and covering downtown Chicago and having 5 houses to go to was going to the roll calls. Yeah, technically your roll call is 8 o'clock, but I had 5 roll calls every single day, and that was some formal and some informal. But that was a way to stay connected and offer of yourself. And that doesn't just have to happen from the battalion chief. It could happen from the assistant chief all the way up to the fire chief. Stop by and have lunch, or give a call and just say, hey, I'm thinking about you guys. Offer some positive feedback. There's a lot of negative things out there right now. And just saying, hey, thanks for being at work today. Assume everybody has stress, financial, physical, mental, emotional, work. I remember one unfortunate week period when I was still working. I had one member whose daughter was attempted suicide. I had 2 members whose spouses were dealing with cancer. I had another one whose wife, who actually was on the job or is on the job, had a miscarriage. And there was 1 or 2 other things. There's always something going on. This is another thing that's happening. But how are we as leaders, and regardless of the rank, forget about that rank, how are we as leaders modeling a atmosphere to stay connected? It doesn't have to come in big giant form, little pieces over a period of time. I don't know if there's one more slide or if that was it. Let me just say this, and I forgot to mention. When you're feeling stressed out, when you're wondering what is really going on, SAMHSA, the Substance Abuse and Mental Health Services Administration, put out a number in regards to the hotline calls increase over the last 2 months. In March, 338%, and in April, 891%. If you guys are going on more calls, guys and girls are going on more calls, if you're feeling stressed at work, if you're exhausted when you get home, there's a reason. People are stressed out right now. What I'm concerned about, and hopefully I think, Chief Ludwig, you're going to have Frank Lido from New York on next week or the week after. But my biggest concern is not right now with what everybody's doing, is what's going to happen in the months to come. And maybe after that is that we're great. As I said, we fight in the face of danger. My concern, in my experience with first responders, is our downtime and our away time. If we don't focus on that self-care and that connection, there'll be distance, there'll be isolation, there'll be hopelessness, and there'll be frustration. So what I want to say again, Chief Ludwig and the task force, thanks for having me on. Hopefully it was information, and my email's there if anybody wants any information.
All right, very good, Dan, thank you. And yes, we will have Frank Lido on from FDNY. I'm not sure when he's scheduled. It's either next week or the following week, somewhere in there. I know our staff is making those arrangements, and I know he's quite abreast of all the mental health issues because of what he's dealing with there in FDNY currently, what he's gone through over all the years. But thank you for all the updates that you have provided. So as we close out, those of you that are online, I want you, when you get offline, go right to iafc.org/take-action. That's iafc.org/take-action. Please send a message to your elected officials in Congress and also the White House that we need this funding in the next stimulus bill on AFG and safer grants. Tell your neighbors, tell your aunts, tell your uncles, tell your cousins. They're all welcome. You don't have to be an IAFC member to go to that action center. So you're all welcome to go there. So with that said, I want to thank everyone who was our panelists today. Again, terrific information, outstanding information. I also want to especially thank Chief Sinclair, Chief Pegram, and Chief Jenkins, all who are chairing different task forces for me. And finally, I want to thank our interim CEO, Rob Brown, and all the members of the IAFC staff who are rock stars, who are working long hours and weekends on your behalf. For those who are listening today, if you have any questions, please email COVID-19TF at IAFC.org. Again, that's COVID-19TF at IAFC.org. I got one response back that was forwarded to me that someone wants to hear unfortunately, the fatality numbers each week, if we can update that on COVID-19, and certainly we're going to try and do that. So our webinar will be next week again at 4 p.m. Eastern Time. We do these every Monday at 4 p.m. Eastern Time. Please go to IAFC.org to register. I am honored, again, to serve as president in this noble profession of the IAFC with so many outstanding people who make a difference every day in their communities. Please join us on our webinar next week as we provide the latest updates and vital information on this coronavirus. Everyone, please stay safe. God bless you, and God bless these United States of America.